Welcome to the Health Daily Show, your go-to where leaders, founders, investors share insights on growth, innovation, business building. I'm Chitra Nabat. Joining us today is Marty Paslick, CIO, HCA Healthcare. Marty, welcome. Thank you for joining us.
Thank you for inviting me.
Marty, HCA is the largest publicly traded acute care hospital system. The company is the bellwether in the hospital industry. Take us into the scope and scale of HCA.
Well, it's true. We're a big organization. You know, we have 2,300 sites of care, more than 180 hospitals. But I would tell you that we're a company of over 50 years old, and we kind of believe in you don't know where you're going unless you know where you came from. And I think it's just important, for your viewers to realize we were founded by physicians, and our mission is really critical to who we are as a company. Different colleges like Alabama, two Alabama grads would say "Roll Tide," or Auburn, War Eagle, back and forth. Well, at HCA, if two colleagues come up to each other and one says "above all else," the other colleague immediately knows they're referring to our mission. And that mission is, the care and improvement of human life. And our founder, Dr. Frist, has a great line. When we talk about the size and scale of HCA, he once said, if we do something important for HCA, we probably have done something really important for healthcare. And I think that says it all when it comes to the size and scale of HCA.
So given that heritage, given the mission, what's unique and challenging about your patient population and the markets you serve?
Well, I'd say, first of all, our patient population is actually more diverse than the actual U.S. population. And that gives us a unique purview into the different types of patients that we could have, the geographic differences. It allows us to leverage, again, the size and scale of our company to really see the volume of data necessary to make better decisions, a variety of data, and obviously a velocity of data. 35 million encounters a year gives us a source of data that we can turn into actionable insights for our clinicians and for our operators.
So when you talk about that volume, that velocity, the data piece, what's the impact of this scale, this complexity, the implications on operations and the economics?
Well, I think, first of all, if you just think about us being a growth company, I think it really starts with having great partnership with our business owners. And I am surrounded by great technologists. Our CEO today is here speaking to all the other CEOs, and I guarantee you his lead-in is about how technology is changing the landscape at HCA Healthcare. And so I can't even tell you the last time there was a strategy at HCA that didn't have a significant technology component. So from a growth perspective, I think we are hand in glove with our operators as far as providing that mechanism to grow.
And if we could go a little bit further on that and some examples to bring that to life, because as you talked about, technology and the IT budget and the team, you lead that, right? Supporting HCA, a more than $80 billion organization with strong operational rigor, and that rigor points to growth this year over revenue, margin, dividend growth. So some specific examples of how you and your team are driving that growth.
Well, I think, first of all, I think it's not just true for us, but any large organization in today's world, first of all, it starts with data. And the construction of both our financial and our clinical data warehouses, I would say our clinical data warehouse is the largest in the provider space. So the scale and what it does for the clinical analytics of the company is profound. Another great example would be, our mobility platform. We are one of the largest users of iOS in the enterprise. We have more than 100,000 iPhones our clinicians use every day to coordinate communication, to coordinate care. And again, I think that's an initiative that not only is huge on a scale perspective, but when we think about the time frame in which we deployed it, that's a differentiator for us at HCA.
And how do you think about supporting speed to market, execution, and efficiency?
Well, I think on speed to market, I think some people would think scale would actually mean going slower. But I would say that once we get to a certain level of scale, then we go at lightning speed. A good example is we're replacing our EHR right now. And I would tell you that at least our plans on the book right now is to deploy it to our 175 hospitals that have that platform in about the same time frame that a hospital system would deploy in 3 or 4. And again, it's that size and scale that really makes a difference. From an efficiency perspective, we talked about the mobile platform. You can imagine how mobile our caregivers are and how putting information in their pocket really matters. But we're also really on the doorstep of really using techniques like automation to get rid of the administrative burden of our clinicians so they can practice what they went to school for.
When you talk about replacing the EHR, removing the administrative burden of your clinicians, that gets into prioritization of budget. How do you balance prioritizing budget and spend between running the business versus innovating and changing the business?
Well, I think the real challenge today, and I'm sure a lot of people that you've talked to, is companies are practicing, financial resiliency in a unpredictable economy, and at the same time pressing the gas pedal just equally as hard on new initiatives that are going to differentiate. In my 38 years, I've seen one or the other. I haven't seen them both at the same time. And I think that's the unique thing right now, at least in our company, is we have to be true stewards of the company's investment and really look in a very persistent way on how to be cost effective. And at the same time, slamming the pedal down on those key initiatives that we believe are going to make a difference for HCA in the long term.
And on those key initiatives over the next 1 to 2 years, 2 key initiatives where you're focused heavily on innovating and potentially looking for partners.
Well, I think replacing the EHR is a gigantic investment when you consider the scale. So that's certainly one of them. The second is, we created a partnership with Google a couple of years ago, and I think we're truly on the doorstep of creating the really the most powerful data science platform in the industry. And I think once that is enabled, we're going to see some really game-changing events. A good example is before, when COVID first started, our data scientists were asked to produce a predictor for COVID admissions. It required nearly 6 months, and they used all of our on-premise systems to do it. We didn't have Google back then. Before this winter, they were asked, can you do a prediction for the combination of COVID, RSV, and the flu? That took 6 months, 2.5 years ago. It took 8 days with our platform on Google and the tools that are associated with it. That kind of speed is going to not only change how we care for patients, but it's going to make us just a more efficient organization as well.
Here at the Vive conference, we're surrounded by thousands of startups that would love to do business with you. I'm sure you're inundated with pitches constantly from startups as well as venture capital firms who back these portfolio companies. Where are you looking to partner with startups, and what's the criteria for them to be let in the house at HCA?
Well, first of all, they come in from all kinds of directions, and I think that is a testimonial to how technologically savvy our company is from end to end. They certainly can come through the technology door, but they come through our special assets organization. Our operators are constantly pitched new ideas, and so we're a little almost an amoeba, right? We have all these connection points of what comes in. From my purview, what makes a startup successful for us, for a company like HCA, is we're looking more for platforms and not so much for a technology that does one special thing. We want to find something that has a little bit more of a Swiss Army knife. We want to make sure that they're on the right path from a cybersecurity perspective, and we want to make sure that if it is something that we truly want to use from an enterprise perspective, that it has all of the makings of a highly available application.
Leadership. Marty, in life and business, there are rules, codes, norms to how things are done. Where have you been a code breaker, and how did you do it?
Well, if you go back a decade ago, I think that's probably the first time when meaningful use first became a thing in healthcare in the 2011, 2012. Almost all of our competition used those funds to upgrade their EHRs. At HCA, we made the definitive decision to put our money with data. And so in 2011, while everybody was replacing their EHRs, we didn't. We decided we were going to build what I said earlier, the largest clinical data warehouse in the industry. I think that was a moment where we could have followed everyone else and we chose a different direction. Once we were done there, I think we broke the code again in 2015, 2016, when we made the decision that we needed a communication system that was a convergence point, and that was a phone, an iPhone, that we could not only message everyone, but we could send alerts, we could provide timely data to. And I think, we're a code breaker when it comes to that as well. And I do believe, our move and our partnership with Google is the next code breaking moment where whether it is just a higher level of machine learning and AI, or it's future technologies like large language models, I think we're positioned yet again to be that code breaker.
Marty, thank you so much for joining us. It's been wonderful to have you.
My pleasure. Thank you.